Hello and welcome to Hyderabad's first ever podcast channel that focuses on the NowThis. And today we have with us Dr. Sevith Rao, the founder of Palunu and IHA. Mr. Sevith, tell us something about the background of Palunu and IHA.
Sure. Well, I can start with my own background. So thank you for the introduction. Very excited to be on this podcast, Omer. So I was
Thank you. It's a
born
pleasure.
and raised in the US, but I got to India as fast as I could, you could say. I did my education. I received my medical degree from Baylor College of Medicine in Houston. And then I received an MBA and Master's in Biomedical Engineering from University of California, Berkeley, as well as joined coursework at Stanford and UCSF. So my perspective is kind of shaped what I'm building currently with IHA, or Indian Heart Association, and Palunu. So I've been fortunate to have experiences across biomedical engineering, devices, and clinical care, as well as scaling up businesses and ideas, which has directly led me to my work here in India.
Well, it's a very impressive background to learn about. Does it get too taxing, or is it something that you're used to doing?
Yeah, I wouldn't say it's taxing, but it is does require some strategic thinking. It is sometimes challenging, but I am very fortunate to be building in India. I think this is a really opportune time to be building in India. I can share a little bit about what we're currently building with Indian Heart Association and Palunu. I can start with Indian Heart Association. India has the dubious distinction of being the global leader in heart disease cases. So India has almost 60% of all heart disease cases occur amongst the Indian diaspora globally. And it's a combination of certain genetic factors and environmental factors as well. We built the Indian Heart Association over a decade ago. My co-founder is my elder brother, Dr. Sevith Rao, who's based in Boston currently. He's an interventional radiologist, department chief in Mass General Brigham Hospital. So this organization has led us through some very interesting experiences. Indian Heart Association really tries to focus on prevention, education, screening. So through these efforts, we've been really privileged to work with the Honorable Prime Minister. We were one of the organizers of Howdy Modi in 2019, as well as we had some really stellar advisors. Former President Dr. Abdul Kalam was one of our chief advisors. Unfortunately, he passed away from a heart attack himself. But we were really fortunate to get some excellent mentorship. In 2023, we were invited experts at G20, which was held in India. And recently, we were actually featured in a documentary called The Brown Heart.
Well, that's a very thorough perspective on the healthcare sector of India. So what led you to embark on this journey of being associated with Palunu and IHA?
Sure. Well, to answer the question about what led me to co-founding the Indian Heart Association, the IHA, really it was growing up, we saw numerous instances of friends and family members suffering from heart attacks at an increasingly alarmingly early age, right? We know several family members and friends having heart attacks in their 40s, in their 50s. And now if you look in, really the news and media reports, you'll see even many younger cases as well. So that was one of the motivating factors of us wanting to go and do something about combating this problem. And through the IHA, we've worked with numerous partner organizations across the country, in India as well as abroad as well. We've been fortunate to conduct screening events throughout the country, publish educational material. So we've really tried to make at least a small difference in curtailing the heart disease epidemic that's plaguing Indians and really the global population.
A thorough study on all things health. It's a combination of health and information, and I think both of these things go hand in glove. And so how do you think this is going to impact the younger generation of India? How informative do you think this is going to be for their growth as a study or a learning for them to be part of?
Sure. So the younger population is, of course, one of India's greatest assets. We have a young and dynamic population, and I think that's what sets India apart from many of the major growing economies. So really tailoring solutions that impact the younger population is something that will pay dividends well into the future. With Palunu, which is a company that I'm a co-founder of, we are creating India's healthcare financial solution platform built by doctors for the healthcare sector. And on one hand, you have a thriving healthcare market in India. Thriving sector in terms of services offered, the breadth and depth of healthcare services. But what we've seen is that there's a severe capital access constraint for many young and budding physicians as well. So with Palanu, we're really trying to create tailored solutions for the healthcare sector, for these doctors, where previously there weren't really any focused solutions for doctors and healthcare professionals. So there are more than 10 million doctors and healthcare professionals in India, many of them whom are very young, right? They've just graduated from their studies and they're practicing now. So we're trying to create solutions that really help motivate not only the established doctors, but also help the younger and budding physicians as well. So we have several different ideas on how we're going to go and implement these solutions, but that'll be something that I really look forward to going and working with the next generation of doctors as well in India.
Well, way to put it. I'm really sure it's going to just help them extensively. So how do you think Palanu and IHA, as two separate entities, have helped you evolve on a global platform?
Yeah, sure. I think in some extent, in some perspective, I've taken my learnings from abroad and tried to incorporate what I've learned abroad to the Indian sector. But I think in many other ways, India, the solutions that are being manufactured in India will be exported globally. So it's almost a change in perspective of what we've seen 20, 30 years ago, where you'd have these global solutions trying to be implemented in India. But I think India is going to be a world leader when it comes to IT services, healthcare services, et cetera. I mean, we've seen really, I'm not talking about just now, but even 5-6 years ago, we saw novel EKG machines the size of a credit card, homegrown in India that were being used in foreign settings as well. There are numerous examples like this. And I think as India continues to make a mark on the global stage, you'll definitely be reading more about homegrown solutions that other countries are going to be using, which is very exciting, and certainly something to look forward to as an Indian.
It's really great to know about all that there is in store for all the countries that are going to be associating with IHA and Palanu. What do you have planned for India in terms of the work you're doing?
Sure. So it's actually an exciting next several months. We'll be working with the MSME sector, which is really the heart and backbone of India, right? These medium businesses. So there's a plethora of different areas where the MSME sector and healthcare intersect. Everything from ambulance services to small and medium clinics in tier 2, tier 3, not just the major cities, but also tier 2 and tier 3 cities, even villages. So we're excited to be partnering with the MSME sector. In fact, next week I'll be going to Delhi to meet with some officials from the MSME sector and the ministry there. So we're excited to be working with the MSME sector. We're also in the process of creating publications more in terms of educational material as well, which is on our website, indianheartassociation.org. So we've created a health content hub, trying to make it more accessible, easy to understand. I'm sure you or maybe friends and family members have come across health topics that sound kind of foreign or that sound very confusing and complicated. We're trying to break that down into really easy to understand, digestible pieces that'll ultimately help heart health for people like yourself and others as well. So these are just a couple of the different things that we're working on that's in the pipeline for India and Indians, and not just major cities, but all across India, including the smaller cities as well.
Looking forward to all those developments taking place in the future sooner. And tell us more about what you do besides the work you're involved in usually.
Sure. I have several hobbies. I love sports, watching and playing sports. Right now, basketball, the NBA playoffs are coming, but are on right now, but I also enjoy playing basketball. I love swimming. I played water polo during undergrad and college as well. So I love keeping active. Love taking hikes and walking with other folks, meeting new people as well. And I think sports are also a great way of just meeting new people, of bonding, and also, prioritizing physical health as well. So that's probably one of the main ways I have fun and enjoyment as well. And other hobbies, I love watching movies, all types of movies, English movies, Indian movies, regional movies as well, and other things like reading books.
That's a huge list of things and really exciting things to learn about. I'm sure besides wearing a lot of hats, you're also a pro at playing water polo and all of that. It's really great to know about your hobbies. So we're going to do a quick rapid fire session. Coffee or tea?
Coffee any day, especially good filter coffee. Though Hyderabad has great chai, so it's tough, but I'll still take coffee.
Can't deny. So sherwani or suit?
Sherwani is just more comfortable. It's classy. Any day, Sherwani.
Well, that's very Indian, and it's really going to be pleasing to the ears of a lot of viewers who will be watching this to learn about your love for sherwani. Where do you think you can take India if you were to start the trend of playing water polo? Yeah.
That's interesting. I think, I've probably passed the prime for water polo, but I think I definitely love to encourage, other folks to get involved. It's a great game. It takes physical skill, but mental skill and strategy as well. So I think more Indians should be playing water polo. Also, swimming is also a great life skill for that. So yeah, if I could somehow motivate other youngsters to get involved, I'd love to work with them.
That's a very good takeaway for all those people who'll be watching this podcast. And they'll definitely be inclined towards the idea of water polo, especially the ones who've been playing polo as a sport individually. Is there any message that you want to give out to the younger generation of India who's more inclined towards eating fast food, more inclined towards letting themselves loose rather than focusing on things that matter in terms of health?
Just I guess a message to the younger folks. It's India has a booming economy. It's now past the $4 trillion mark, overtaking Japan. So things are, on one hand, things are definitely moving upwards, and it's positive. But I think along with the growing economy, you need a healthy population, right? With things like pollution, sometimes it's difficult to control. There are things that we can control. That's within the possibility of making small changes. And I think physical activity is definitely something that we're all, the majority of us do have some control over. So, try prioritizing making small movements, going for little walks, taking stairs, doing activities that you enjoy. It doesn't have to be the same monotonous treadmill routine, but it could be, going out and playing pickleball or whatever the next in thing is. I'm not sure, but just prioritizing taking small movement breaks throughout your day will definitely hopefully pay positive health benefits later on.
I'm sure all those who'll be watching this podcast will be able to take notes of what you just mentioned, and going to be really helpful for all of them. It was a pleasure talking to you, Dr. Sevith.
Great podcast.
Thank you for watching this podcast, and thank you for living in the now with us.
If you want to live in the now with us, then you can subscribe to the channel right now.